Welcome! This video goes over the background, methods, and results of our project. The vagus nerve represents the main component of the parasympathetic nervous system. Some studies have shown that stimulation can help treat conditions like depression and rheumatoid arthritis, so we're keeping an eye on the future clinical potential as well. There's a branch of the nerve that goes to the ear, called the auricular branch. This is where we're targeting for stimulation, specifically the cymba concha area. Next, we mold a custom earpiece, and by delivering a small current across the skin at the cymba concha, we can stimulate the vagus nerve. For our study, we're doing this stimulation at a level where they cannot feel it. There are past studies also looking into the effects on the brain of vagus nerve stimulation, with most of them using bold fMRI. This study is measuring cerebral blood flow, so it will provide a related and complementary measure to what we currently know. To measure this blood flow, we use an MRI technique called Picasso. And with it, we get maps like this, where the bright values mean high perfusion of blood to that area. For experiment design, we have a single blind repeated measure setup. In the experiment, each subject comes in for 2 separate days of scanning, one control day and one treatment day. This order is random, so the subject doesn't know which is which. In each of these sessions, there is a pre-section of MRI scans, then the stimulation session, and then the post-section of MRI scans. On the control day, we do a sham stimulation. By doing this for every subject, we finally have our data sets. We compare the post-pre differences of the treatment session to the post-pre differences of the control session. The control session shows us any placebo effects of a sham treatment. And through a 2-sided paired t-test, we can see what parts of the brain respond significantly to the treatment. This figure shows the standard M&I space as underlay and our t-statistics map as an overlay. It's thresholded at a p-value of 0.01, but boxes below that don't meet the threshold are still displayed with their transparency adjusted based on their magnitude. Overall, this gives a sense of the geography of the effects. When we keep our voxel-wise 0.01 p-value threshold and correct it for multiple comparisons at 0.05, we get a few significant clusters. And this is the same thing, just zoomed in on the clusters that survive. Let's look at the 2 clusters one by one. Right now we're looking at the right cerebellum cluster. The top figure shows the average CBF values within the cluster for each of the 4 underlying scans, for all subjects. There is no significant change from pre to post for the control day, but the treatment day shows a big decrease after treatment, which drives the overall result. The bottom figure shows a view on how robust this result is. We do a leave one out analysis where we rerun the t-test multiple times, excluding each subject one at a time. Then we count up how many times the cluster of voxels remain significant at a 0.01 voxel-wise p-value threshold. The red color means the voxel stays significant no matter who you exclude. There's a decent core to the cluster that is pretty robust. Now let's look at the left cerebellum cluster. We have the same graphs as before, but here the control day shows a small increase in blood flow from pre to post. The treatment day once again shows a big decrease in blood flow, just like in the other cluster, which drives the result again. And overall, we see that the results are quite consistent no matter which subject is excluded. To summarize, our results show a bilateral decrease in blood flow in the cerebellum following treatment with vagus nerve stimulation. Thanks for watching. Feel free to contact us if you have any questions or comments.